So I have an order to place this patient in soft wrist restraint. So I'm going to show you how to apply a wrist restraint and tie it correctly. It has to be in a quick release knot. Anytime I walk in the room, I'm going to raise the bed to my height. I'm going to do hand hygiene. I've got on my regular gloves. I do need to assess, because this is going to go around the wrist, I'm going to assess pulse quality, and I'm also going to assess cap refill. And then because this patient will be restrained, will not be able to use their arms, you know, there are certain things that we will have to assess frequently after while the patient's in restraints, and you can review those in your book. So the restraint is going to go around the patient's wrist. Make sure the restraint goes all the way around. Bring the strap completely around to these two D-rings. So I've gone in through one or through both and then back through the other. So now this is completely secured in the D-rings. Restraint has to be tied to a non-movable area. So we're going to use the bed frame. I'm going to bring the whole strap behind this frame here. I'm going to lift it up, and then the rest of this, make it nice and snug. Tuck it behind this piece here. And I've got a small loop I'm bringing down. I'll do this a couple of times. Once I get this small loop, bring my fingers in. I've got the rest of this tail. Just kind of, my fingers are just through the loop. Bring it through and pull. So that makes a tight, quick release knot. The patient cannot get up and pull their IVs or whatever they might have been pulling out. And if I needed to get it off quickly to assess the patient, turn the patient, I pull my strap and that knot comes out. And the rail, not the rail, but the bed frame. Snug, pull a loop around and pull it down. Put my hand through the loop. There we go. Quick release knot. Safety. Put the bed back down. You need to do this on the other side.